Let's talk about cholesterol and arterial health. You know, cholesterol often gets a bad rap in the media and from your doctors. And if your labs are over 200 for your total cholesterol, they often recommend that you get on some type of lipids support like statins. I want to talk about some of the myths about cholesterol, also talk about some of the root causes of arteriosclerosis. Then I want to give you some top foods and nutrients, as well as lifestyle tools that are going to help you to have better cardiovascular health. So if this is something you're looking for, continue on. We're going to talk about this in a little bit more detail. Here are a few of the myths out there about cholesterol. First of all is eating high cholesterol foods like in eggs is going to raise your overall cholesterol. This is just not true. Your total cholesterol is mostly determined by your liver and how your liver is operating. Another myth is going to be all LDL cholesterol is bad. This also is not true. The ApoB is the one that is the most important, that is the one that creates the stickiness of the arteries and can cause an accumulation of arterial plaque. Another myth is the lower the cholesterol, the better. I've seen labs from people that have brought them in from their doctors and their total cholesterol is at 130 and it's circled and says good. To me, that is terrible. You need cholesterol to make hormones. You need cholesterol to make all of your cells. A double lipid layer exists on every cell. And if you're going to rebuild cells, you need to have cholesterol. You also need cholesterol for many of your hormone fighters, and you need cholesterol to bind up toxins. Another one is if your total cholesterol is normal, you're fine. This also is a problem. It is your LDL and specifically your ApoB portion of the LDL that is the problem, not your total cholesterol. So let's talk about the different types of cholesterol. You have lipoproteins. You have LDL, which is low density lipoprotein. Think of this like a delivery truck that delivers the cholesterol from the liver to the organs, and it has to go through the arteries. Then you have very low density lipoprotein. These are actually triglycerides that are being delivered from the liver to the different organ systems. And then you have high density lipoprotein, which is often increased by exercise. This one is actually a garbage truck that's picking up the garbage from the cells, from the arteries, and bringing it back to the liver. So different types of cholesterol play different roles. The body needs all of them, but again, it's the VLDL and the LDL and particles of those that are actually the problem. Now let's talk about arteriosclerosis. What is this? Well, it is hardening of the artery from plaquing. But some of the root causes are not just from cholesterol. Yes, cholesterol is part of the problem, but some of the other ones that are much more important to consider are chronic systemic inflammation that's coming from other sources, whether it be toxins, whether it be poor diet, lack of exercise, or a lack of balance between your omega-3s and omega-6s. Another one's going to be insulin resistance. If you have a metabolic problem where you're not managing your blood sugar, this is going to lead to eventually arteriosclerosis. And then you have toxins and lifestyle factors that play a big role in this as well as oxidative stress. So oxidative stress is kind of like a reactive oxygen species that comes from your normal exhaust from your mitochondria, but also from breakdown in a lot of the chemical reactions in the body. This is where fruits and vegetables, vitamin C, vitamin E, selenium, and these antioxidants are very helpful in mopping up a lot of this oxidative stress. And lastly, you've got emotional stress that we deal with that can create some of this problem as well. There are many tests besides just your total cholesterol that will give you a better picture of your overall cardiovascular health and vessel health. So besides the total cholesterol, you have LDL, HDL, VLDL. Then you have the subparticles, particular in particular is ApoB, apoprotein B. This is the one that's one of the more important ones to look at when it comes to your potential for plaquing of the arteries. The other things you need to look at are insulin resistant markers, whether it be insulin itself, ferritin, total glucose, and also hemoglobin A1C. Then you have inflammatory markers like C-reactive protein, ESR, and homocysteine. These all will tell you if there's some inflammation in the body that could be in the vessels or could be in the liver, or could be in the heart as well. So looking at all these different labs are important to give us a clue of how your cardiovascular health is. One of the most important ways that you can help your cardiovascular system is look at your diet. You want to make sure that you're eating fresh fruits and vegetables and healthy meats. And you also want to eat fresh, healthy fish, like from salmon, wild salmon, and wild tuna sources. These are going to give you omega-3 fatty acids, which help to balance the omega-6s, which are pro-inflammatory. Omega-3s are anti-inflammatory, so they're going to reduce the inflammation. You'll also want to look at green leafy vegetables and beets. These actually help to improve nitric oxide, which improves blood flow. Another thing you're going to look at is olive oil, which is going to give you healthy fats. And then you'll look at walnuts and some other nuts that are going to help to reduce inflammation and give you magnesium. And lastly, you want to add fiber to your diet. This will also help improve your overall cardiovascular health. Some of the nutrients that are helpful for the cardiovascular system, we mentioned one already called omega-3 fatty acids. These are great to help reduce that inflammation. Magnesium is another great nutrient to get. And again, if you can get it in your vegetables and in your nuts, that's a very good source, as well as berries. But this helps with the rhythm of the heart, and it helps with decreasing stress. B vitamins are a great one to help with chemical reactions that need to happen. They are cofactors and enzymes. K2 is great to help take away calcium from the arteries to prevent some of that buildup. And then the last thing would be fiber, as we talked about as well. There are different types of fibers that you can take to help with this. Along with nutrients and diet, you want to look at lifestyle tools. So some of these are very inexpensive. Getting outside, getting some sun, getting grounding, that helps you to get the vitamin D, which is another one we didn't mention. Exercise, whether it be walking, swimming, biking, or resistance, yoga, these are all great for blood flow, for lymph flow, and also the cardiovascular health. Then you have looking at stress management, looking at your lifestyle, looking at your schedule, making sure that you're living balanced. You also want to make sure you're sleeping well, making sure that you're getting consistent sleep, at least 7 to 8 hours a night. You want to stop smoking, and you also want to make sure that you are doing some meditating or breathing exercises of some sort. These are going to help to bring your stress levels down. Finally, I want to emphasize that this was not meant to serve as medical advice. You should be under the care of your physician if you have cardiovascular disease or high cholesterol. But I do want to emphasize that there are lifestyle and dietary things that you can do to help improve your cardiovascular health. There are tools and there are labs that you can look at that will help you to understand more. If this is something that interests you, we're going to be doing more on cardiovascular health, specifically HRV and stress. So like and follow, and we'll be putting out more videos. I'll see you in the next video.